April Cook, Adult Health 1, Term 2, Section 2, mini bag and IV administration, in addition to piggyback, in addition to a primary bag. I need to check my physician's order for the medication that's being ordered. Patient has ordered Flagyl. I have checked the lab, verified the labs, verified whether the patient has any allergies to food or medication. The patient does not. The labs are in check. The drug makes sense for the patient who's here for dehydration and possible infection. And the infection, the Flagyl that the physician ordered, 500 milligrams, will treat that infection. Okay. The antibiotic, Flagyl is an anti-infective. The action is disrupts DNA and protein synthesis of susceptible organisms. The purpose is the treatment of anaerobic infections. The recommendation is 15 milligrams per kilogram, and then after that, initially 7.5 milligrams per kilogram. There are side effects of dizziness, dry mouth, seizures, encephalopathy, optical neuropathy, and neuropathy superinfection. And for my patient, physician ordered 500 milligrams. I received a vial of Flagyl from the pharmacy, which it states 250 milligrams per ml. So for my patient, I'm going to pull up 2 mLs totaling 500 milligrams, and I'm going to inject that into a 100 ml bag that's going to be my piggyback, in addition to my patient's fluids that are already running. Now I have checked my patient's MAR. I have the right route, the right patient, the right dose, and the medication makes sense, and the frequency and administration. Okay? And so initially what I will start with is I need to pull up my 2 mLs of my medication so that I can inject it into my bag. So what I'll do is I am going to clean my Flagyl. I'm going to take my syringe. I'm going to pull back my 2 mLs. It's been clean. Pull back 2 mLs. Perfect. Now this is sterile. I just removed the cap. I'm going to inject 2 mLs. So now, and then I'm going to take this and I'm going to put it in the sharps container. I'm going to move this around. I am going to label this. This needs to have my patient's name, the time, the date, my name, my initial, the time and date, in the drug, the dose, and the administration. So now that has been pulled up, I am ready to go to my patient's bedside, but I need a way to get my medication to my patient. This has been labeled, it's ready. I'm going to take my tubing. This is a secondary tubing. I'm going to label this, put my name and my date on it. And once I'm done with this, which I'll show later in the video, I'm going to put an alligator clamp, because these can be used, let's say this patient needs another medication, this can be used again so the patient's not charged again for the same device. I am going to inject. I'm going to go ahead. This is sterile. I've just pulled the cap off. Inject it in. Excuse me. I'm going to clean this. This is sterile. And I'm going to inject it. Alright, let it fill up. Prime my tubing. Priming my tubing, the action of this is to get all the air bubbles out. All the air bubbles out. Alright, I have air, I have water, the medication all through the tubing, so now I'm ready. I'm going to go into my patient's room, educate my patient of what's happening, verify that I have my patient. Hi Mr. Jones, can you please lift your name and date of birth? When I walk in, I'm going to let me backtrack. Initially when I walk in, I'm going to hang this here. Go ahead. I'm going to talk to my patient. Hi, Mr. Jones, what is your name and date of birth? He verifies his name and date of birth. I look at his wristband. This is the right patient. I'm educating him on the medication and the reason for the medication. I take a look at the IV. The IV site looks good. There's already fluids going, so I'm going to piggyback that on. Mr. Jones understands. He consents. one thing in the previous, I'm not sure if it was made clear that when I always go in a room, I always verify that the patient can respond to their name and date of birth and check their wristband for patient safety, that I have the correct patient. Okay, I'm going to wash my hands, put my gloves on. All right, look at my IV, everything is good. Now I am going to, the piggyback bag always needs to be higher than the primary bag. The site that I'm going to hook it on, go ahead and clean that off. This is sterile, so now it's clean, everything's good. And what I will need to do now is set my rate for my medication. Pull it down, I'm going to set it right. I'm going to look at my watch while I get my 17 for my medication, the dosage. Excuse me. 17 drops per minute. I'm going to count while I'm rolling my clamp. And now I have 17 drops. I have it to 17 drops per minute with my clamp. And because it is higher and it's at a higher port, it's going to flow in faster. Let my patient know that's going to go over an hour. Come back in 10 to 15 minutes to check on them. Once I leave the room, come back in 10 to 15 minutes. Everything looks good. Patient has no complaints. There's no mottling to the skin. The vein has not blown. They're tolerating it well. They don't have any side effects. I tell them another 45 minutes and I'll be back. 45 minutes has passed and I see that my tubing, that all my medication in my mini bag is gone. What I'm going to need to do is I'm going to clamp this off. I'm going to disconnect it. I'm going to put an alligator clamp on my tubing so that this can be used again. It's sterile and it can be used again, and I'm going to hang it. Now I need to set my primary tubing back to its flow rate initially that it had already, so I'm reestablishing its flow rate. Alright, and then I'm going to take all my needles and syringes and deposit them in the appropriate containers. Now I need to document on my MAR the medication that was administered, the time, the drug, the dose, and the route, which was Flagyl. The route was IV, 500 milligrams, 17 minutes, 17 drops per minute. The condition of the IV site, which is great, the patient tolerated it well, and record the volume. That is IV piggyback administration.